What are the criteria for acute stroke treatment? Imagine suddenly losing the ability to speak or move part of your body. When that happens, quick action can make all the difference. That's why understanding the criteria for acute stroke treatment is so vital. Medical teams follow strict guidelines to decide who can benefit from urgent interventions that can save brain function and improve recovery chances. These guidelines are based on extensive research from trusted sources like the American Heart Association and the World Health Organization, ensuring that treatment decisions are safe and effective. The first step in stroke care is rapid assessment by a trained healthcare professional. They need to determine exactly when symptoms started, which is called the last known well time. This helps decide if the patient is within the treatment window. Initial exams include checking vital signs, blood sugar levels, and performing brain imaging, usually a computed tomography scan, to see if there's bleeding or a blockage. Quick evaluation is essential because the goal is to start treatment as soon as possible, ideally within the first few hours after symptoms begin. For intravenous thrombolysis, which involves giving a clot-busting medication called alteplase or tissue plasminogen activator, the main criteria include being at least 18 years old and presenting within 3 hours of symptom onset. Patients must have a confirmed ischemic stroke, not bleeding, and their blood pressure must be below 185/110 millimeters of mercury. Blood glucose should be above 50 milligrams per deciliter to avoid hypoglycemia. The brain scan should show early signs of ischemia but no large areas of damage. Patients on certain blood thinners or with bleeding risks may be excluded, especially if their clotting times are abnormal. In some cases, if the patient arrives between 3 and 4.5 hours after symptoms started, thrombolysis can still be considered, but only after careful evaluation and in specialized centers. Mechanical thrombectomy, or endovascular therapy, is another critical treatment for large artery blockages. It involves threading a device through blood vessels to remove the clot directly from the brain. Eligibility depends on the time since symptoms began. If the patient arrives within 6 hours, they are typically candidates if they are over 18, have a significant blockage in the internal carotid artery or middle cerebral artery, and have a moderate to severe stroke severity score. They should also have good pre-stroke function and a small to moderate stroke core, which is the area of brain already damaged. For patients between 6 and 24 hours, advanced imaging techniques like perfusion scans help identify those who still have salvageable brain tissue, called penumbra. These criteria are based on recent clinical trials that showed many patients benefit from thrombectomy even in extended time frames. Special considerations include the presence of large vessel occlusions, which are major blockages that often cause severe strokes. When such occlusions are identified, decisions about thrombectomy should not be delayed, even if the time window is beyond the usual 6 hours. Rapid screening with neurovascular imaging is essential to determine eligibility for these procedures. It's also important to evaluate the patient's overall health and stroke severity to guide treatment choices. After the initial emergency treatment, a thorough workup is necessary to find out what caused the stroke. This might include additional imaging of blood vessels, heart tests, and blood work. Understanding the cause helps prevent future strokes. For example, if a clot originated from the heart, anticoagulants might be prescribed. If artery narrowing caused the stroke, procedures like carotid endarterectomy or stenting could be considered. The goal is to tailor secondary prevention strategies to each individual's needs. In summary, the criteria for acute stroke treatment are carefully designed to identify patients who are most likely to benefit from urgent interventions. These guidelines balance the potential benefits with the risks, aiming to maximize recovery and reduce disability. Always remember, if you or someone else shows signs of a stroke, immediate medical attention is crucial. Healthcare providers use these evidence-based criteria to make swift, life-saving decisions. If you want to know more about stroke care, Consult with medical professionals who can provide guidance tailored to individual circumstances.